Across the country, more children's hospitals are seeing a spike in common respiratory illness called RSV.
This has North Carolina health workers worried that RSV, along with flu and COVID-19, could stress hospital and school nurses. Celeste Smith is following the story and joins us now live in the newsroom. Celeste, what are they saying?
Hi, Hannah and Jeff. A new-Hanover-County Health and Human Services spokesperson and a doctor with Novant Health say there has been an increased reported cases of flu among children, but parents also need to be aware of RSV, which can have concerning lingering effects. Novant Health pediatric doctor Amra Zuzo says she has seen a steady flow of patients coming in, with mostly colds and the flu. But in the last week and a half, Novant Health clinics have seen a significant uptick in RSV, or respiratory syncytial virus cases. RSV is a common respiratory virus that usually causes mild cold-like symptoms. Dr. Zuzo says they have also seen an increase in the number of complications that occur 2 weeks after RSV infection, like younger children getting pneumonia. Dr. Zuzo is offering tips to parents on RSV symptoms to be on the lookout for in children.
Persistent cough that's interrupting sleep, wheezing, trouble breathing. So oftentimes we'll show them which muscles to look at. So you always want to raise your child's shirt and look at their chest to make sure that they're not breathing too fast. Sometimes you can even see nasal flarings.
People infected with RSV are said to be contagious for 3 to 8 days. Babies and older people with weakened immune systems can spread RSV for up to 4 weeks. New-Hanover County Assistant Health Director Carla Turner says people can also have RSV and the flu at the same time.
They're different viruses, but you can be infected if you're exposed. And, if you think about it, if you have one and your immune system's kind of down a little bit fighting that, and you're exposed to something else, you may very well become infected with that as well.
She also says there has been an uptick in sick absences at New-Hanover County schools. Health and Human Services has a nurse at each school who are tracking the absences and symptoms.
So with these schools that we've had some increased absences, part of our responsibility as public health nurses is to follow up on that. And so those school nurses, along with some of our communicable disease staff here in our building, to see if they're sick, and if they're sick, what are their symptoms, and have they been to the doctor, and have they been tested? And then we keep a line list of all that so we can keep track of what's going on. And we're constantly communicating with the state if we see increased numbers at schools.
There is no vaccine for RSV currently, but treatment methods include clearing mucus from airways, nasal saline sprays, and breathing treatments. Health officials are also advising people to get their flu shots.